coronavirus update. We've got 2 cases in Georgia. He'll be bringing us the latest on Friday. Vice President Pence is going to be here to also bring us an update nationally on what's going on right now, having freshly qualified for the United States Senate for a second term. Senator David Perdue joining me. Good morning to you.
Good morning, Eric. How you doing?
I'm great. How about yourself?
I'm good.
Now, so you qualified yesterday. This has kind of turned into a big ceremonial thing in Atlanta with people that they wait until the last minute and do a big fanfare. You just went on in there and decided to go on and qualify without all the pomp and circumstance some of these people bring to it. I appreciate you doing that, by the way.
Well, I'm an outsider to this whole process. I don't quite understand the pomp and circumstance. I don't think our founders would either. You know, for the first 124 years of our country's existence, Eric, you know, the Senate and the House up here only work 45 days a year in Washington. And along that actually the Senate and the House up here work during the summer. So this is never, I don't think the founders ever intended to be quite the way we have it today.
I suddenly have a Green New Deal proposal the Republicans should make. Turn off the air conditioner in D.C.
I can't wait.
No, so
you know, I characterize what you just said as from hayhire to high water.
There you go.
And I've been all over this state. The country was headed in the wrong direction, and I was right. We had the lowest economic output in U.S. history for 8 years. We had demolished the military. We had backed up from our commitments overseas. We were, you know, giving people like Iran a pathway to a nuclear bomb. I mean, bad things were happening out there. But we, you know, I think my first poll, Eric, was 3% with a 4% margin of error. You know, seriously, it was, as an outsider, it was a whole new deal. Running for re-election is a hard thing to do. I mean, I did not take this lightly. My wife and I talked about it and prayed about it, and we decided that the work wasn't done yet. Now, you know, I believe in term limits as well, so I'm not dominated by this.
Worse, and neither side really has an incentive to rein in the spending right now. Now, of course, we've got the coronavirus outbreak, and we're spending billions to fight that. Who say they want small government, not actually voting for it.
You know, the irony is that the drive to get reelected is a lot easier if you just give money away. Mm-hmm. And that's been going on for 50 years. The problem is the total $5 trillion that we spend as a federal government. You know, the other 3.7 is mandatory. The discretionary part has the military, the VA, and all discretionary programs. That's ag, that's all of our safety nets, everything. We've fired 9,000 people at the VA for not doing their jobs. The problem is over in mandatory. That's because Medicare's trust fund goes to zero in 6 short years, Eric. You talk about this on your show all the time. This is a crisis of our own making. We can fix it. In a second term, we'll be able to get this done.
Well, and you know, it seems like they refer to it as the third rail in politics, and I suppose it really by daring to even raise it and become demagogue. I mean, let's not forget even Paul Ryan, who wanted to make some reforms. The Democrats filmed out.
Social Security. We don't want to do that. No Republican wants to do that. But what we've done by growing the economy, we've lowered the debt curve, honestly, by $5 to $37 trillion in the next 10 years. That just can't happen. The world won't let that happen. So this is serious. We've got to get on it. Growing the economy is the first step. Trump's on that. We've done that. It's moving. The economy is moving very well. In the last 2.5 years, 3 years really, 2.5 million people have pulled themselves out of poverty because we've created opportunities. And actually, I believe if we can get momentum and keep infrastructure.
Senator, I've picked up a couple more stations down along the South Georgia line, and I hear federal government helping farmers through some of these situations. And now, of course, the mild winter puts in jeopardy whether or not the peaches are going to be good, and farmers are starting to with the situation with farmers.
Well, everything you just mentioned is what farmers have to deal with, unfortunately. That's what makes it such a God-given career. Unlike what Michael Bloomberg says, you don't just put a seed in the ground, throw water at it, and then everything works out. Dirt. We got great people. Normally we have pretty good weather, and it works. We've had some really outstanding travesties happen here in the last couple of years. I'm very frustrated. The bureaucracy shows that the deep state is here, and it takes a long time to deal with that. The bureaucracy is what slowed all this down. I give President.
Listen, Senator, I would love to spend more time with you, but we've got the wild card coronavirus situation, and we got the governor and the commissioner from Department of Public Health just excited to have you on the ballot.
Well, Eric, look, thanks so much. You're one of the few people around that get the truth out, and that I think it's so important. I get asked this question all the time: where do I go to get my facts? Where do I get information? And
David Perdue from Washington, D.C., running for re-election. He qualified yesterday. Kelly Loeffler as well qualifying for re-election. And I apologize to him and his team that happened by here in about 5 or 6 minutes. I'm trying to do good clock management to make sure we can get the governor in here as well and bring us up instead of for coronavirus. Now, Anthony Fauci, who is the head of the National Institutes of Health and the National Institutes for Allergies and Disease, he is now saying he's actually starting to think that the mortality rate fatality rate rather for COVID-19 is going to be is that we don't yet know because the virus is aggressively mutating whether or not that will stay the case. We know, for example, from the Spanish flu outbreak in 1917 and 1918 that the initial wave of the virus was rather no one's expecting that of COVID-19 right now. Don't panic here. Nobody's expecting that. They just don't know in this first round season of what's going to go on. What we do know for certain is developed some symptoms, had enough foresight to think I might be infected, called their doctor. Now, this is a brilliant American citizen. I don't know who this person is, but they need to be praised. They won't give the name out, but this person really should be praised. Came back from Milan, largely decided to stay home just to be on the safe side. When he developed symptoms, called his doctor, explained he had been in Milan, needed to get tested, but didn't want to potentially infect anyone, drove himself to the doctor's office, went in through a back door, avoided everyone. The clinician there was prepared to test and keep themselves secure. He was tested, found positive, home. His spouse now has coronavirus as well. They are quarantined in Fulton County in Atlanta in their home with the rest of their family who he came into contact with, and where they will be for the next couple of weeks. But that is what you want to do. That was well done on their part. But there's more. And then, of course, he was on an airplane with other people while he was infected. And we know that the disease can be contagious prior to symptoms developing. Governor Kemp is going to be joining me here in a few minutes, so I want to step out now to go on to commercial break. And when we come back, we'll be joined by Governor Kemp's team to give us an update.
National Connections, Local Focus.
Welcome back from the North Georgia mountains to the Florida line, covering the whole state of Georgia now. It is Erick Erickson and the Erick Erickson Show. The phone number 877-97-ERIC, 877-973-7425. Joining me from Atlanta, Governor Brian Kemp. Good morning. Not the conversation I was hoping to have with you right now.
Good morning, Eric.
So what can you give us as the latest on the coronavirus situation here in the state?
Well, it's pretty much what we said last night. We do have 2 confirmed cases. We've had people working 24/7 since we found out about this late yesterday afternoon to, do the investigation. The folks are doing well, very mild symptoms. They're confined at home with other family members to make sure that they're not spreading the virus. We're backtracking now to see what kind of contacts they've had. But I would just tell people the risk remains very low for most Americans. Obviously, people that are elderly, have, existing health conditions and are medically fragile are the ones that we're really worried about if they get the virus, much like's happened in Washington. So we just need people to continue to follow the guidelines that everyone's saying. If you're sick, stay at home, call your health care provider. Don't go to the doctor's office first. Give them a call. Let them talk it through with you. Talk through your travel history, if any, what your symptoms are, and then they can develop a way to get you into the office and do testing if it's warranted. So that's kind of where we are. Hopefully we'll know a lot more toward the end of the day or tomorrow, but we are literally working 24/7. But I will just say this, and I'll give it back to you, Eric. This is something that we've been preparing for weeks now. We've got Dr. Toomey and her team at the Georgia Department of Public Health. She's got a lot of experience, decades in public health, and we got a great team around her. So I'm really confident about the response so far and what we're doing to prepare for the future, whatever that may be.
I was really struck last night during the press conference by both you and Dr. Toomey noting that this patient who had the coronavirus actually had the foresight after coming back from Milan, Italy, to largely seclude himself and go to the doctor and call ahead and make sure he didn't interact with other people. Really, just whoever it is, just a super diligent person to begin with. They took those steps themselves.
Could not have asked for more out of this individual and the health care provider. We have been in contact. Dr. Toomey's team has been in contact with, doctors, the medical community, hospitals, county health officials to make sure people knew what to do if this event happened, and the medical provider did exactly what they were supposed to. They tested the individual. They notified the Department of Public Health. The folks are doing home confinement. And, we couldn't ask for anything better. And that's really what the message is to Georgians out there. If you run into the same type scenario, or if you have traveled to Italy or, South Korea lately, and certainly China, then you need to be really aware that you're more susceptible to this than, most Georgians are, and to just be cognizant of, what the symptoms are. And if you start feeling bad, just stay at home and make those phone calls for us.
I was struck last night. One of the questions in the press conference was about just going and getting the itinerary of the individual's flight and start reaching out to those people. And there's a story in the New York Times today that it's not actually that simple for the government to go to Delta or whichever airline and say, hand me a list of all the people and addresses who are on this flight, which to some degree slows down the process of checking and making sure no one else on the flight had it or got it from this individual.
Well, that's one of the reasons we wanted to do that last night, so you just didn't have misinformation out there on the internet or in the press that it was coming from us. It's like Dr. Toomey said, we were not concerned about the individuals that were on that flight because the patient did not have symptoms at the time they were flying. It happened a couple of days after they were back home, so we don't believe there's any risk for those passengers. So, they're running down the leads that they need to right now. We'll certainly, we're going to be transparent. I mean, this is what it is. The best way we can deal with it is for people to have the facts and know and do what we're asking of them, and we'll continue to do so.
Governor, listen, I know you've had a busy day, and thank you very much for stopping by and talking to us about this. I think the Vice President's going to be joining me on Friday. Just real quick for you, I understand yesterday you did talk to the Vice President as well?
I did. We were on a task force meeting with some of our group with video conference. I think there was 52 other governors and governors of states and territories on that call. Went very well. We had a task force meeting at the Capitol yesterday at 3:00, and then a couple hours after that, maybe 2.5 hours, we found out about the confirmed cases. And then I spoke to the vice president shortly after that just to make sure he was aware of that. We had a great conversation. He was filling me in on some of the things that they continue to do at the federal level, pledge their full support and resources. So I feel really good about what the administration has been doing and what they're doing now.
There was a scene yesterday I saw on social media of empty store shelves in northern Atlanta, some people starting to panic and go out. I'm assuming people don't need to go out and buy grocery stores out of all their goods.
No, they don't need to panic. I think, obviously having some food at home if you get sick where you don't have to go out is a wise thing. But, I would do that within reason, continue to practice great hygiene practices if you're, out and about in the public, and just be smart about what you're doing in your daily lives and with your kids and otherwise, and just keep an eye on them. If people start feeling sick, then, stay at home and call your doctor.
Governor Kemp, thank you so much. I really appreciate it.
Have a great day, Eric. Thank you
too. Governor Brian Kemp. So just to review, we've got 2 people in Fulton County, Georgia, who have now tested positive for the coronavirus, COVID-19. One of the 2 individuals, they're a couple, as best we don't really know a lot about them. The governor can't give details. In fact, the governor doesn't know all the details himself about the individuals because of federal health care privacy laws. What we do know are the essentials that are needed to kind of figure out the parameters here. We have a couple. We presume a married couple. One of the 2 of them went to Milan. We presume, based on the way they were talking last night, it was the husband had gone to Milan and returned. We don't know whether it was a direct flight to Atlanta or an indirect flight. We presume it was a Delta flight direct, but again, we don't know. The individual was home, had no symptoms for several days, developed symptoms at their home. Had the foresight enough to know, having gone to Milan and come back, that they should probably minimize contact. When symptoms developed, reached out to their primary care physician, explained they had been in Milan and they probably needed to be tested for coronavirus, drove themselves to the doctor's office. The doctor allowed them through a secure backdoor area away from all the other patients. The clinician who performed the test, already properly dressed to keep themselves from getting the virus, covered this individual's mouth to make sure that any coughing or anything would not spread, put him into a room, did the test. The test came back positive, sent the person home, notified public health authorities. The person has agreed voluntarily in quarantine. Their spouse is now tested positive as well for the coronavirus. They are, as the governor just said, quarantined with their family, who also came into contact with both individuals, in their home for a 14-day incubation period, which we now know there's been a lot of back and forth on how long it could possibly take. Most clinicians are now saying it is a 14-day full incubation period for a lot of people, and so they're going to be there under watchful eyes of the state to make sure they don't leave. And anyone they've come into contact with in the past few days, they're going to work backwards and try to find those people. But again, the government cannot just go to Delta and say, give us a list of all the names who are on the flight with this individual. They're not allowed to. And in fact, there's legislation now being drafted in Congress potentially to change this. But the state of Georgia is not allowed to do that. So they're having to do other ways possible. There's your coronavirus update. Got a little more when we come back. Thanks to the governor and Senator Perdue for coming in this morning on all this stuff. All righty, let's review, shall we? We've got coronavirus in Georgia. Now, I want to say a couple of things here, and we will get into Super Tuesday. That really is the big story. But there are a couple of things I wanna say to you first, because one, I've gotten some complaints from people that I am spending way too much time on the coronavirus situation, that it's a minor situation, and you've always got to find balance in how much you cover news stories like this. And the reason you've got to find the balance is because it is an urgent situation in that this is new. You don't want to scare people. You don't want to overplay the situation, but you also don't want to underplay the situation. Where do you find the line in this becomes very difficult for a lot of people in the media. I've got a number of friends of mine who say this is overblown. It's no big deal. The media is scaring you. Remember, if you will, in 2014 and 2015 here in Georgia. And for those of you listening nationally, you'll remember these stories. In 2014, towards the end of 2014, snow came into Georgia, and it was treated as a very, very, very big deal. And it turned out not to be. And a lot of people laughed it off and thought it was silly, thought it was a waste of time, thought it was an overreaction. And in January or February of 2015, I believe it was, the snowstorm came through. And the government made it a big deal again. But they waited because the storm at first was coming in and they presumed it would be raining everywhere except for the North Georgia mountains. And then suddenly it exploded. And it became not just ice, but it became snow. We at our house in Macon got about 5 inches of snow. It was actually between South Atlanta and the Griffin area, south of 75. You only got about an inch of snow, and then suddenly it picked up again with the moisture flow in middle Georgia, and the kids were out of school for multiple days. It was a wreck, and people were stuck on the interstate in Atlanta, and it was because the government didn't want to scare people, didn't want to shut down businesses if it was an overreaction. The weather system broke late towards ice, and people were stranded. I literally started my radio show in Atlanta, so I do my 9 to noon show statewide, and then I do 4 to 6 just in Atlanta. And I started my 4 to 6 show at 3 p.m., and I did not get off the air until 7 a.m. the next day because people who were supposed to come on couldn't get to the office. And so I literally sat at my desk from 3 in the afternoon until sunrise the next day, and just fielded phone calls from people stranded on the interstate saying, I'm stuck. Here's the mile marker I'm at. My insulin has run low. I'm a diabetic. Can someone come help? We had several of those calls, as a matter of fact. We had another call with people who were stuck in their car with their kids and needed rescue, and people were listening to me on the radio. In fact, I've got a buddy who I know did it. He had me on his radio, and he and several friends with four-wheelers and CBs or walkie-talkies were going out and trying to help people stranded on the road in their area if they heard people calling in. And we fielded phone calls all night long from people, and it was just me keeping people company on the radio who were stuck and they needed help. And as a result of that, the next storm that came through, the government made sure that everyone knew, everybody shut down, and it wasn't a big deal. But there was, where do you find the balance in this? It's very hard. It is also very hard because everyone knows that China is lying. And China is where we have the overwhelming amount of data on this. I mean, let me give you right now, just for perspective here, so that you understand why we're in the situation we're in and why everyone is focusing on this. It really is important for you to let me give you the updated numbers as of 9:39 this morning. And these numbers will be revised here in the next hour. There are 92,196 confirmed COVID-19 cases worldwide, 3,129 deaths, 48,175 recovered people. When I went on air yesterday, there were 66 confirmed cases in the United States. This morning, there are 105. Yesterday, when I went on the air, there were 2 deaths in the United States from the coronavirus. Today, there are 6. So we've had more than double the number of deaths in the last 24 hours from the coronavirus. And so 6 divided by 105 times 100. So that's a 5.7% mortality rate in the United States from the coronavirus. Only 105 people thus far have gotten it. But the problem with the coronavirus and the reason people are raising awareness of it is any one of you listening to me right now, I don't care where you are in the state of Georgia, the odds of you getting COVID-19 are actually very, very small. And so you're listening to this and you're thinking, why is he spending such an amount of time talking about a virus that none of us are going to get? The reason is because the odds are very, very small that any of you are going to get it. But if any of you do get it, the odds are everyone in your immediate circle of friends and community are going to get it as well, because it spreads rapidly in communities. And that becomes the problem. Luckily, in this country, most people have foresight to go to the doctor, give them a heads up, and make sure that they understand. I mean, take again, the coronavirus patient in Atlanta had enough foresight. He came back from Milan and thought, I've been in a city where there's a deadly virus spreading, and I should probably not go anywhere in case I've gotten it, because it takes a while for symptoms to show up. So he stayed home. He developed symptoms. He calls his doctor and says, I've been in Milan. I think I have COVID-19. Can you please test me, but minimize the presence to other people at the doctor's office? You heard the governor. You could hear it in the governor's voice, how impressed he was that the individual did that. And the doctor's office as well took the precautions to let the individual in from the back door, sanitized everything, made sure the doctor's staff were safe when this happened. That was a good thing. It was well thought of, but not everyone does that. I want to tell you about patient 31. There are 5,186 people in South Korea now who have COVID-19. 5,186 people in South Korea have COVID-19. Originally, Korea had 30 people who tested positive. Actually, they had one person who tested positive, came back from Wuhan, China, and then that person had interacted with many people, and you had 10 more people got it, for 11 total. And then other people coming back and forth, you wound up getting 30 people. And then there's the 31st person. We don't know how patient 31 got COVID-19. She had not traveled to China. It is a she. We don't know. What we do know is that patient 31 went to the doctor not feeling well, and the doctor told patient 31 she should get tested for COVID-19. And do you know what patient 31 did? Patient 31 went to church. Went to a large church of several thousand people in Daegu, South Korea. And then went to an all-you-can-eat buffet with a friend, despite having fever, despite not feeling well, went to an all-you-can-eat buffet with a friend. Still did not get tested and went back for a second church service of several thousand people. They can trace 1,200 cases of COVID-19 to that one individual. And a number of those people have died. I told a friend of mine last night, I think he might be listening, a quarter of those people have died. That's not actually true. It is less than that have died. There are 28 total deaths in Korea, but some of the people that this person came into contact with had moved out of Korea, and it does look like of the 1,200 people, more than 50 of them have died, some of them having gone back to China and elsewhere. 28 total deaths in South Korea. But this patient 31, they can trace over 1,200 cases of the coronavirus to this one individual. That's how highly contagious the disease is. Now, increasingly, we are seeing that the disease is not as bad as we thought in terms of fatality. And in fact, the younger you are, the more likely you are to be a carrier and not actually have symptoms of the disease. And that's somewhat problematic. Y'all, I had some crazy person call me in conspiracy theory mode, or not call me, direct message me on Instagram in conspiracy theory mode that what actually is happening is China invented this disease to infect kids as carriers and then wipe out the adult populations to benefit the Chinese government and the communists. I'm serious that someone actually sent me that as a direct message on Instagram. Conspiracy theory cuckoo time. And that's deeply problematic. The issue is the older you get, if you're above 65, you have a 15% mortality rate. Right now, in the United States, the mortality rate is 5%. Globally, they expect it. Anthony Fauci from the National Institutes of Health expect once we realize who all got the disease and didn't die, that the fatality rate will actually be around 1% or less. It could be more like a terrible seasonal pandemic flu, which is actually good news, believe it or not. The problem is that right now, there are a lot of people getting it. They don't recognize the symptoms. They don't know they have it, and they don't seek medical treatment until it's too late. They don't notify everyone. And so when it gets into your community, the odds of you getting it are actually really, really slim to none. That's why even Governor Kemp is saying you don't need to panic. You don't need to rush out. And there was a video of someone, and I forget where it was. It was in Gwinnett County, Georgia, in a grocery store where all the shelves were empty. It was like we had a flake of snow on the ground. People went in, all the milk was gone, all the bread was gone, all the beer was gone, all the soft drinks were gone, all the chips were gone, all the pasta was gone, most of the canned goods were gone. You know, it's actually kind of funny. I've always wanted to go in one of these mass outbreaks like this, one of these mass panic modes, and see what are people not buying when you've got this mass panic. Oh my God, we're all going to die. Go to the grocery store. What is it that people don't actually buy when they go to the grocery store? Huh. Bob, no one's buying the fermented artichoke or on the international aisle. We still got some Marmite and lemon curd over here. Nobody's buying that stuff. But all the frozen food gone. The bread was gone. The milk was gone. All of the beer. There was not a can of beer left in the grocery store. That would be my first go-to item. I mean, it was all gone, and it was in North Atlanta. People panicking over the COVID-19, and this was before there were 2 cases announced in Atlanta. People had panicked and had gone into this grocery store. There's no reason to do that. And some people are naturally prone to panic and anxiety, and I get that. But what if the media wasn't actually talking to you about this? We have this. We've got a disease. Again, in the United States right now, there's a 5% mortality rate. That number will come down. The 6 people were elderly in Seattle who died. That impacts it greatly. I think some of them had been on the cruise ship. That's the problem. 7 have recovered, 6 have died in the United States. We've got 105 cases right now. No, I'm sorry, 106 cases right now. The number is going to come down. But if the media and the government did not tell you what was going on, there would be as many people convinced of conspiracy theory as there are right now. Oh, there's the strange. We have this, this actually happened. 2 years ago, we had a big flu outbreak. If you'll recall, 2 years ago, the flu vaccine did not actually contemplate one of the strains of flu that was going around. And so there was a massive flu outbreak 2 years ago. And there actually were conspiracy theories out there then about something going on and with the government and the flu. We would be seeing this. So everybody's got to be educated on where the coronavirus is and what it's doing and where it's spreading in this country, because if it gets into your community, it sweeps through your community. So you want to be proactive. You want to be advised of where it is and just how bad it is. And as more and more information comes out, what appears to be happening is we're finding out that the survivability rate is actually going up. The fatality rate is going down, and that's all very good. But we also have to spread awareness of it. And I've gotten so many people now who have emailed me and said, stop talking about it. It's not a big deal. It actually is a very big deal. And I have to admit as well, I'm biased. And you need to understand my bias. I've got lung damage. My wife has lung cancer. Were we to get it in our house, it would probably not end well. And so I'm a little more concerned about random virus for which we have no immunity or vaccine than some of you are. And some of you are in the mode of, oh, well, this is overhyped. The media overhypes everything. It's all about ratings. And you're more skeptical than you should be. Perhaps I'm a little bit more concerned than I should be. But there's a balance in there somewhere that we can together get. But it does me no good to downplay when the government is saying, hey, you need to raise awareness about this. And I've got a statewide radio program here in Georgia where the governor can come on, one-stop shop, and talk to every citizen in Georgia who's listening to the radio. He can come on and do this, and that's good, and that's a good thing, and that's what we need. On Friday, Vice President Pence is going to do the same thing. Vice President Pence is going to be joining me on Friday here on the program to also give an update on the coronavirus. He's on the task force. Now, here is Dr. Anthony Fauci. He is the guy everyone respects. He is the head of the National Institutes of Health. Remember last week the media said he was muzzled. He wasn't actually muzzled. He had to scale back appearances to coordinate with the vice president's office. But here he is on TV last night on CNN.
Well, Allison, it's always dangerous to make predictions, definitive predictions, but I'm concerned that you're going to see a lot more cases. I mean, certainly when you have a number of cases that you've identified and they've been in the community for a while, you're going to wind up seeing a lot more cases than you would have predicted. So my concern is, as the next week or 2 or 3 go by, we're going to see a lot more community-related cases, and that's of great concern.
And here he is with Chris Cuomo last night.
One of the things that we are hearing more and more, I think this virus has been here a long time, and they're not telling us how long it's been here. It's been here for months or longer, and they're numbers that we haven't heard yet. What do you know about when the virus established itself here and how much spread there has been and the accuracy of the numbers?
Chris, it's almost certain that it established itself here on a travel-related case from China. How long it was and that the situation evolved to have other cases, it's tough to say. But I can say with some degree of confidence, I don't really think that there was a lot of infection going on under the radar screen before we knew about the first infection. I just don't think that's the case.
How confident are you in the numbers that were being given right now?
Well, the numbers that are given right now of the people that are recognized, I would not at all be surprised, Chris, and I don't think there's anybody that would disagree, that there are going to be cases that are out there now that we haven't yet recognized, that we will soon recognize. I think it's tomorrow or the next day or the next day, we're going to see cases. And the reason I say that is that whenever you have community spread, which means by definition, you don't have any direct link to any other known infection. They just appear in the community. The fact that you have community spread, almost by definition, means there are going to be more that you're not aware of. And that's the reason why the kind of aggressive identification, isolation, and importantly, contact tracing that the CDC is collaborating with the state and local health authorities is extremely important, extremely important.
That's what's going on, folks. The virus, we've got 2 cases in Georgia, is nothing to be alarmed about, but is very much something to be aware of. What do you do to prep? How do you get prepared? And does washing your hands, is that really it? Well, we'll discuss that when we get back.
Erick Erickson gives you the information.
In all of this talk about coronavirus, I just want to be very clear with you, very, very clear, that no Democrats and no members of the media are politicizing this. Our moral and social betters in the press have told us only people at Fox News are politicizing the coronavirus.
We have a crisis of coronavirus, and President Trump has no plan.
What he's doing is late, too late, anemic.
Mr. Trump is late.
As soon as this virus started cropping up elsewhere in the world, we should have been on top of it.
Do you trust, and should Americans trust, President Trump to deal with this crisis?
No.
This is an administration that does not believe in science, and so I'm not surprised that he's completely clueless.
Look, the president we know is not a scientist, and that's a nice way to put it. He doesn't even believe in science.
This president hasn't allowed his scientists to speak. The idea that the experts are not allowed to speak, the president has silenced them, Dr. Fauci.
I'm not being muzzled. I was cleared here, and here I am talking to you, and I'll give you the whole truth the way I always have.
I've been talking about this for a while. They don't even have a test kit.
Well, we've already tested over 3,600 people here in the United States. I'm not sure what he meant when he said there's no lab kit.
You know, the idea that Donald Trump said just several days ago this was a Democratic hoax, what in God's name is he talking about? Has he no shame?
The Trump administration has been asleep at the wheel.
We know he doesn't have the capacity or the competence to handle such moments.
I cannot think of a worse person to put in charge of dealing with this coronavirus.
And his response has been pathetic.
This is not a Democratic hoax. This is incompetence on the part of the President of the United States.
And his incompetence really does put us all at risk.
President Trump, good morning. There's a pandemic of coronavirus. Where are you? Where is your plan?
But no, none of them are politicizing this. No member of the media is politicizing this. No Democrat is politicizing this. Nope. No, it's just people on Fox News. The media tells us it's just people on Fox News who are politicizing this. Pay no attention to the cartoon in Politico that was of a man committing suicide when he found out Donald Trump was in charge of dealing with the coronavirus. Nope, nobody would politicize the coronavirus here except Republicans, according to the media. When we come back, it is Super Tuesday. What is Super Tuesday anyway, and why does it matter, and what's going to happen to Bernie Sanders? We'll discuss. Hello and welcome. It is Erick Erickson here this Super Tuesday, March 3rd. It is 6 after the hour. The phone number, if you want to be a part of the program, is 877-97-ERIC, 877-973-7425. You can always get me on the best. You people should be following me on Instagram at EW Erickson. That's where you see the non-political. I don't like to do politics on Instagram. I like to put up pictures of cooking. I roasted a great chicken the other day. She's from cooking to photography. We were all going to get fat, so she enrolled me in a class to learn how to take pictures, and now I take pictures of my food, and we still get fat. Well, I do, because Super Tuesday is today. At the bottom of this hour, though, Jerry Henry from Georgia Carry is going. There is legislation pending in the state Senate. Senate Bill 350 openly, or actually concealed, rather, in organization. And so I wanted Jerry to be able to come on and give their take on this. They're going to join me on my evening program today to talk about it. He couldn't be here this morning, and so I'll play my interview with Jerry this evening, and then also came by to talk about the coronavirus in Georgia. There are 2 cases in Georgia, and the governor wanted to bring us an update to 33777. If you want to listen to the Substack, I've already pushed it out, and you can listen to it there. If you want to see the update on the coronavirus nationwide, or it's Johns Hopkins University dashboard, but also you will get a link back to where I've gone on and put the Governor Kemp audio, and I wanted to walk you through Super Tuesday and what's at stake for the Democrats. Can the rest didn't qualify. For example, the state of